Con el inicio del semestre académico comienzan las tareas de los estudios y también las laborales, y eso lo sentimos en nuestro cuello, espalda, cintura, columna vertebral. Afortunadamente, el Recinto Universitario de Mayagüez es la única institución universitaria en Puerto Rico en contar con un quiropráctico en casa. Hi, how are you?
Nice to see you.
Thank you. El Departamento de Servicios Médicos, adscrito al Decanato de Estudiantes, en colaboración con el Decanato de Administración del Recinto de Mayagüez, gestionaron este servicio de salud integral que es parte del Programa de Clínicas Externas de Servicios Médicos. De esta forma, la comunidad universitaria tiene al alcance de tan solo unos pasos a un quiropráctico.
There's so many benefits, actually. I mean, just from maintaining a normal state of flexibility and health. A lot of times people, especially the students, I mean, here on campus in their prolonged postures, being held hostage, studying, can lead to a lot of postural fatigue. And in those cases, if something should slip, slide, or move out of its normal position and just prolong some of their pain and agony in addition to studies. I mean, regular chiropractic care seems to be able to prevent most of their aches and pains. I know I see a lot of students, and that's been one of our goals for years, to actually come on campus and look after students for that very goal.
Mm-hmm. What are the recommendations regarding the chiropractic care?
Well, it varies case to case. And, depending on a person's condition, obviously if somebody has had an injury, a car accident, or some kind of trauma, their care would be a little bit more intense, maybe 3 times a week, for instance, while we're getting the patient through the acute stages of their injury. But for somebody who, for the most part just suffers day-to-day aches and pains related to prolonged positions of posture, I mean, a secretary at her desk, I mean, a student, again, studying, those types of situations, again, case to case. But, usually I hate to have somebody, just show up when they are not in pain. But again, the wisdom is, and, there's studies now that actually show the benefit of regular maintenance care, so.
Let's say weekly?
Weekly for many students is a great idea. I usually suggest when we first start, I mean, a couple times a week, and then we try to basically space out the treatments as far as possible, while they're having pains. And then again, just for those regular maintenance type of visits, I usually say at least no more than once every, 3 to 4 weeks.
Los quiroprácticos tratan a personas con problemas musculares y óseos, como dolor de cuello o de espalda, entre otras condiciones. Lo hacen con ajustes que corrigen las subluxaciones, que son las disfunciones articulares que irritan los nervios.
We're simply just assessing for the normal, anatomically correct position of bones as they relate to the joint and that position. And through various means of what we call motion palpation, we can determine whether something isn't moving correctly or in its proper position. And then we do a series of gentle stretches to place things back where they belong. And the treatments themselves are, rarely ever painful. Most people actually, love their chiropractor, and the treatments feel good. And then there is sometimes when people hear a little noise, I mean, like when somebody cracks their knuckles. And one thing we observe a lot is while we are treating somebody that has, some misalignments or things that are out of position, there is often that noise associated with the treatments. And then 2 ways people can tell they're improving or getting better is obviously they feel better, but a lot of that noise goes away when things are just moving correctly.
So we get misaligned on a daily basis?
On a daily basis, yeah. Some people are, sleeping postures are very unique to every individual. So you have some people that are like a fish out of water and flipping and flopping all night long. And some of the positions that they, wake up in or are asleep in are less than, let's say, ergonomically correct.
El Dr. Mans está ubicado en la oficina 105 de Servicios Médicos y brinda servicios los martes de 8 de la mañana a 12 del mediodía, así como miércoles y viernes de 8 de la mañana a 12 del mediodía y de 1 a 4 de la tarde.
There isn't anybody that doesn't benefit from coming in and having an assessment and having some treatment. You know, I tell my engineering students that every machine needs to be calibrated from time to time. The human machine is no different, you know, and if somebody's never seen a chiropractor, I mean, I highly encourage them to. I mean, if you have never actually had all of your parts and pieces essentially assessed as far as their position and whether things have kind of found their way out due to bad postures or injuries, you know, just living life. You know, it would be just similar to somebody who has never picked up a toothbrush and brushed their teeth. Imagine what their teeth would look like. So, you know, it's a good idea just to have regular assessments and come in and include chiropractic in your overall health and wellness plan. The absolute uniqueness of UPR Mayagüez allowing a chiropractor on campus to provide services, this is the only campus in Puerto Rico that actually has that service to offer. So it would be great if more people knew of the service and actually came in to take part.
Para Prensa Room, en la Cámara José Jiménez, informó Mariam Ludim Rosa.